Right, the Biden administration is pushing to administer the COVID shot to pretty much every living American. And most likely, as soon as the FDA approves usage for children under 12, which could be around October or November, they will push for kids to get the shot as well. Now, the question is, will this push be based upon the science? Now, President Biden brought up vaccines and masks at last night's town hall meeting hosted by CNN.
Everyone under the age of 12 should probably be wearing a mask in school. That's probably what's going to happen. Secondly, those over the age of 12 who are able to get vaccinated, if you're vaccinated, you shouldn't wear a mask. If you aren't vaccinated, you should be wearing a mask.
Joining me now to talk about what the science says or doesn't say is Dr. Marty Makary, professor at Johns Hopkins School of Medicine and School of Public Health, editor of MedPage. He wrote an article that appeared earlier this week in the Wall Street Journal on the topic of making sure we have the right data to make vaccine decisions. Dr. Makary, welcome back to the program.
Great to be with you, Tony.
So your article is, I think, very timely as we move toward the start of the school year. I have no doubt that children and COVID shots is going to be a topic of big discussion. You did some digging into this. You said there's a kind of a number that the government is looking at and reporting on. What's that number and why is it significant?
Yeah, so thanks for the question. Look, I am very pro-vaccine. I've gotten vaccinated, encourage everybody who doesn't have immunity to get it. And remember, immunity is two forms, vaccinated or natural immunity from prior infection, something the government has ignored. But when it comes to kids, we've imposed a tremendous amount of restrictions on kids for the last year and a half based on one number, and that number is 335 COVID deaths in kids under 18 during the entire pandemic. Now, I'm not downplaying that number, but has the CDC ever called the families and those doctors who took care of those kids and asked if COVID actually caused the illness? They have not. Have they risk stratified? In other words, do what we do in public health, and that is figure out what percent of those kids had a comorbid condition and how many of them were healthy? Because we're making recommendations for healthy kids based on data that may be clustered around those with comorbid conditions. They've not done that either. So they've got very sloppy data by which they're making these decisions. And by the way, 500 kids die of the common cold, RSV virus, each year.
Right. And I'm actually with you on this issue of vaccines. I'm not against vaccines, but I think we should have the right data and the right information and make our personal choices. I think it should be individual choices. And I want to get into the issue of immunity here in a moment and how that works. But I want to go, your research team looked into apparently approximately 48,000 children under the age of 18 that had been diagnosed with COVID. Share with us what your information, what you uncovered as you looked at the evidence.
Yeah, so we looked at 48,000 COVID cases in healthy kids, and no healthy kid died. No healthy kid died of COVID. The mortality rate was 0 among healthy kids. And that's what we need the CDC to be doing with that number of 335 deaths in kids under 18. Tell us how many healthy kids died, because that makes a big difference. Remember, we're imposing tremendous restrictions on them. So without that information, how can we really be making informed decisions?
You brought up another issue that for me, I've had issue with, and that is the issue of natural immunity. That's not being tracked. It's not being reported. From my perspective, what I've seen, it's not even being factored into the CDC and to the federal government's policies and procedures.
Yeah, what happened was they dug in early when many of us raised the point. We said, hey, wait a minute, early in the pandemic, natural immunity appears to be pretty durable, and we need to focus the vaccine rollout on those who don't have natural immunity. Remember, back in December and January, we had a very scarce vaccine supply. It was hard to get. And many of us were saying, focus on the non-immune, those who don't already have it. And we were dismissed. And guess what? Every single month we have this argument. And now natural immunity is strong a year and a half later, durable, effective, maybe more effective than vaccinated immunity, and it's going strong. So that has been one of the greatest failures of the current public health officials and administration as ignoring natural immunity from prior infection. If you have it, you probably don't need the vaccine. You can have the vaccine, but it's not required.
Now, Dr. Makary, you talked about the vaccine being scarce, last year or earlier this year, but there's still parts of the world where the vaccine is scarce and the demand is even greater. Should we not, in good stewardship, being, more selective in who we tell you need the vaccine as opposed to those who, as you say, may have natural immunity?
Yeah, absolutely. I couldn't agree more. And I wrote a piece a few weeks ago in the Washington Post about how we've become myopic. The ethnocentrism right now is dominating, and we look like a country of waste and excess because we are right now with the way we're stewarding the vaccine. We're paying people. California's paying $116 million to people to get the vaccine. We're throwing millions of doses in the trash because the FDA tells us they've expired. We have to remember, as we're talking about boosters and vaccinating every newborn in America right now, there are people dying. There's healthcare workers who are vulnerable, dying overseas because they don't have enough supply. We got to think about the world.
Dr. Makary, we're up against the break, but very quickly, is this being driven more by politics than science and how we deal with COVID?
I think there's an old school medical mentality, which we have trouble competing with them. A bunch of us go on Fox and different networks, but it's hard to compete with a few people that are making all the decisions. I think industry is driving some of this narrative too, by the way, and I think people hear multiple points of view.
Yeah. Dr. Marty Makary, great to talk with you. Thanks so much for joining us today.
Thanks for having me.